Um, when our campaign that we're working with in Pennsylvania is Let's Talk About It, is because they just exposing that, deconstruct the messaging campaign, explain why people are doing it. I talked a bit about managing stress in my talk today. We actually developed worksheets and toolkits of with handout sheets, and how do you talk about understanding the relationship between relieving stress and tobacco use. And in that, we then talk about some of the things I mentioned briefly today about the craving withdrawal syndrome and the interpretation that it's calming. Well, in reality, I'm experiencing this elevated stress that actually is setting up my central nervous system to be more sensitive to environmental triggers that will trigger my next cigarette. And so it's just maintaining cigarette sale. So basically, consciousness raising is how I approach that. Or there's a lot of, when you start talking about culture, I did a 3-year study in residential care, and the underground behavior around tobacco use is huge, where I like to say the street behavior comes into the clinic. The selling of loosies is big business in any behavioral health program. And it's the big secret that everybody knows. But the credibility of hooking you up to that Lucy there's a status to it. It gives somebody a street credibility. So in a lot of our inpatient facilities or whatever that are tobacco free, that person that maybe was selling other substances out on the street and developing their respect in their community by that status, now they're going to take those skill sets of dealing loose cigarettes, underground in that facility, that tobacco-free facility. And there is a huge amount of inference into that with regard to how they look upon that person as a peer, the exchange of different transactions that everything that we know about with regard to other substance dealing is happening with cigarettes. And that's a cultural, I like to talk about that. I'll go right into those things. And the dude that's selling the loosies out on the corner, is this helpful to recovery, or is it counter to the spirit of recovery? Are we keeping secrets? What's the value of doing or not doing this behavior? Not in a punitive way, in a therapeutic way, but to know how to engage discussion around that where nobody feels like they're getting beat up, but I'm really interested in what you have to say. I'm really interested in your perspective of how and why these decisions and this behavior is happening. And so that we call that tobacco awareness. And that could be, the facilities around here that are selling cigarettes, the convenience stores, the single cigarettes or whatever. Just by talking about it really raises conscious, and it will expose the ambivalence towards it. And that's our, of course, in motivational interviewing, we want to expose and then, neutralize ambivalence towards a topic in behavior change. So talking it up, how do you talk about it is the answer that is the way we approach all of that. So you don't confront it, you lead with facts, and then you just are neutral in the position of exploring the perspective with others.